Hello and welcome to Workers' Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome back, everyone, for Season 2, Episode 1 of Workers' Comp Unwrapped. With me today is Aisha,
Hi.
who has 15 years of experience in the workers' comp industry. Today, we're talking about how medical providers can counter inappropriate denials and successfully overturn them using best denial management practices.
Yeah.
You know how frustrating it can be to deal with denials
Oh, absolutely.
in the California workers' comp system, right?
Yeah,
It's like hitting a wall when you're trying to get your patients the care they need.
totally.
Yeah.
It's a common pain point for medical providers.
Yeah.
Not only can denials delay essential treatment for injured workers,
Right.
they can also significantly impact a provider's revenue cycle.
Yeah, for sure.
Yeah,
It's a lose-lose situation.
absolutely.
But here's the thing. Not all denials are created equal.
No.
We're going to focus on those pesky inappropriate denials, the ones based on flawed reasoning or misapplication of the rules.
Yeah, that's right.
Aisha, can you walk us through some examples of what this actually looks like in practice?
Sure. So imagine a scenario where you have a patient with a knee injury
Okay.
who clearly meets the criteria for an MRI as outlined in the MTUS.
Great.
The Medical Treatment Utilization Schedule.
The MTUS.
It's the gold standard for treatment guidelines in California workers' comp.
Oh,
Yet the claim gets denied for insufficient clinical evidence.
oh, wow.
This is a classic example of inappropriate denial due to misinterpretation of medical necessity.
Right. It's almost as if they didn't even look at the MTUS guidelines.
Exactly. Right.
It makes you wonder what's going on behind the scenes.
Yeah, it does.
Yeah.
And that's not all.
No.
Think about a denial that hinges on a simple missing signature on a form,
Right.
even though the care was provided and documented appropriately.
Oh, I see.
These procedural technicalities can be incredibly frustrating,
Yeah.
especially when the underlying care is valid.
Right.
Yeah.
I bet that makes providers feel like they're being nitpicked.
Yeah, they really do.
Yeah.
Yeah,
It's easy to get disheartened and just accept the denial.
right.
But what would you say to those providers, Aisha?
Well,
Is it even worth fighting back?
absolutely.
Really?
While it's easy to feel overwhelmed, remember, knowledge is power. Understanding why inappropriate denials happen
Okay.
can help you approach the appeals process strategically.
Okay.
For instance, insurers process a huge volume of claims daily,
Oh, wow.
often relying on automated systems.
Right.
These systems are primarily focused on cost containment,
I see.
which unfortunately can lead to errors and oversights.
So it's not always intentional or malicious?
Not necessarily.
Right.
Yeah.
It's just a system that may not be equipped to handle the nuances of every individual case.
Exactly.
But then again, it's still our responsibility as providers
It is.
to advocate for our patients
Right.
and make sure they're getting the care they deserve.
That's right.
So how do we bridge that gap?
I think one crucial step is to really understand
Yeah.
the regulations governing California's workers' comp system.
Right.
I know it sounds daunting,
Yeah.
but focusing on key elements that directly relate to denials can make a world of difference.
I see.
For example, Labor Code Section 4600 is critical.
4600.
It outlines the guidelines for medical treatment for injured workers,
Right.
specifying that treatment must be reasonably required to cure or relieve the effects of the injury.
So that's a good starting point.
Yeah.
But let's say we've done our homework.
Okay.
We know the rules.
Yeah.
And we still get hit with a denial that just doesn't make sense.
Happens all the time.
Right. What's our next move?
That's where the independent medical review process comes in, or IMR.
IMR.
It's a crucial safety net that allows you to challenge a utilization review decision
Oh.
if you believe a treatment was inappropriately denied
Right.
based on medical necessity.
I see.
It's like having an impartial expert weigh in on the case.
So if the insurance company's initial review isn't in your favor,
Right.
you have the right to escalate it
You do.
and get a second opinion
Right.
from a neutral party.
That's right.
That's good to know.
Yeah.
But I'm guessing there are some specific steps involved in filing an IMR.
There are.
Right.
You're absolutely right. There's a formal process to follow,
Okay.
and it's essential to understand the deadlines and requirements involved.
I see.
One thing to remember is that you only have 30 days to file an IMR
Oh, wow.
after receiving the utilization review denial.
Oh, wait, 30 days.
So time is definitely of the essence.
Okay, so we need to be organized and efficient if we want to utilize the IMR process effectively.
Exactly.
Is there anything else we should be aware of when it comes to navigating these denials?
Don't forget about the official medical fee schedule, or OMFS.
OMFS.
This is a critical tool for ensuring you're being reimbursed correctly for the services you provide.
Okay.
The OMFS establishes the maximum allowable fees. For different medical procedures and treatments in the workers' comp system,
Right.
understanding it can help you spot underpayments and ensure you're being paid fairly.
It's almost like having a secret decoder ring
Kind of.
for understanding the system's payment structure, right?
It is.
But all of this can feel overwhelming,
It can.
especially for providers who are already juggling a million things.
Absolutely.
What advice do you have for staying organized and making the most of their time
Yeah.
when dealing with denials?
Let's think about it this way.
Okay.
What if you could approach denial management proactively rather than reactively?
I like that.
One key strategy is to analyze your denial trends over time.
Okay.
Are you seeing similar types of denials popping up repeatedly?
Yeah.
This could be a sign of a systemic issue in your billing or documentation processes
Okay.
that needs to be addressed.
So it's not just about fighting individual fires,
It's not.
but looking for patterns
That's right.
and addressing the root causes to prevent future denials.
Exactly.
Okay.
This approach can save you time and energy in the long run.
That makes sense.
For example, if you're noticing recurring denials related to missing documentation elements,
I see.
you can work on standardizing your documentation practices and ensuring your team is consistently including all necessary information.
That makes a lot of sense.
Yeah,
You're basically turning those frustrating denials into opportunities
that's right.
to refine your processes and make your practice more efficient.
Exactly.
I'm curious, are there any other strategies or tools that providers can leverage to streamline this whole denial management process?
Absolutely.
Yeah.
Technology can be a powerful ally.
Oh, okay.
Think about AI-powered billing software that can flag potential errors before you even submit a claim.
Wow.
It's like having a second set of expert eyes reviewing your work
Right.
for any red flags that could lead to a denial.
That sounds incredibly helpful.
It is.
It's like having a built-in safety net to catch those mistakes before they become bigger problems.
Right.
What other tech tools are out there?
There are also sophisticated reporting tools that allow you to monitor denial trends and identify recurring issues.
Right.
These tools can provide valuable insights into your practice's performance
Okay.
and help you pinpoint areas for improvement.
So you can use data to make smarter decisions about your denial management strategies.
Absolutely.
It's like having a real-time dashboard for your practice's financial health,
It is.
specifically related to workers' comp.
Uh-huh.
This is great stuff, Aisha.
Thanks.
But before we go any further,
Okay.
I want to emphasize that communication is key throughout this process.
Oh, for sure.
Yeah.
I completely agree.
Right.
Building a strong relationship with your insurance representatives can go a long way in preventing misunderstandings and avoiding formal denials in the first place.
Pick up the phone.
Yeah.
Have a
that's-
conversation.
yeah, absolutely.
Build a rapport.
That's right.
It seems so simple,
It is.
but it can be incredibly effective.
It can.
It's about fostering a collaborative environment
Yeah.
where you can work together
Right.
to resolve issues efficiently.
Right. Yeah. Precisely.
Open communication can often resolve issues before they escalate into formal denials.
Yes, absolutely.
It sounds like a win-win for everyone involved.
It is.
Okay, Aisha, we've covered a lot of ground today. I know our listeners are probably eager to hear about some real-life examples and best practices for tackling specific types of denials.
I bet.
So we'll be diving into that in part 2 in this episode, so stay tuned.
Sounds good.
All right, we're back. Ready to get into the nitty-gritty of tackling those inappropriate denials.
Let's do it.
Aisha, what are some specific strategies that providers can use to successfully appeal these decisions?
Well, let's break it down.
Okay.
Think of the appeals process like building a strong legal case.
Okay.
Your documentation is your evidence.
Got it.
Remember those detailed medical records we talked about earlier?
Right.
They are absolutely crucial when it comes to supporting your appeal.
I see.
Each note should clearly state the clinical necessity for the treatment you're providing,
Right.
with direct references to the MTUS guidelines
Sure.
whenever applicable.
I see.
Don't be afraid to spell it out for the insurer.
Okay.
Like, this treatment is consistent with MTUS guidelines for this condition because
So it's not enough to just follow the guidelines.
Right.
You need to explicitly demonstrate that you're following them in your documentation.
Exactly.
Like creating a clear roadmap for the insurer to follow.
Yeah.
Showing them exactly why the treatment is justified.
Precisely.
Okay.
And don't just rely on your notes.
No.
Think about all the supporting documentation you can gather.
Okay.
Diagnostic test results, progress notes,
Right.
patient history, anything that strengthens your case
I see.
and helps paint a comprehensive picture of the patient's condition
Okay.
and the necessity of the treatment you're recommending.
It's like building a fortress of evidence
Yes.
that they can't ignore.
That's right.
You're not just saying, trust me.
Right.
You're showing them the concrete reasons why this treatment is essential for your patient.
Exactly.
Okay.
And remember, you want to make it easy for the insurer to understand your reasoning when you're crafting your appeal letter.
Right.
Think about it from their perspective.
Right.
Clearly outline each point of contention,
Okay.
address their specific reasons for denial,
I see.
and provide concise, evidence-based counter-arguments.
So it's not about getting emotional or defensive.
No.
It's about presenting a logical,
Right.
well-structured argument,
Exactly.
supported by facts.
That's right.
It's almost like being a lawyer
It is.
for your patient's care.
It is.
Right.
It's a great analogy.
And just like a good lawyer wouldn't show up to court without their case files.
Exactly.
You don't want to submit an appeal without attaching all the relevant supporting documentation.
No, you don't.
Remember those meticulously crafted medical records, diagnostic reports, and progress notes?
Right.
Now's the time to put them to good use.
That's right.
It's about creating a compelling narrative
Yeah.
that leaves no room for doubt.
Exactly.
You're showing the insurer that you've done your due diligence,
Yes.
you understand the rules,
Mm-hmm.
and you're advocating fiercely for your patient's best interests.
Right.
But let's face it, even with the best documentation and a solid appeal letter, this process can be intimidating.
It can.
Wow.
It definitely can be, especially for providers who are already stretched thin.
Sure.
But remember, you don't have to go it alone.
Okay.
There are resources available to help you navigate these complexities.
Oh, that's reassuring.
Yeah,
It's easy to feel like you're on an island when you're battling these denials.
it is.
So knowing there's support out there is a big relief.
It is.
What are some of the resources you recommend?
Well, one option is medical lien management. They specialize in navigating the intricacies of the workers' comp system.
And can handle the appeals process on your behalf,
Lexi.
freeing up your time and energy to focus on patient care.
So it's like having a seasoned guide in the confusing jungle of workers' comp.
Yeah, I like that analogy.
Right.
They have the expertise and experience
Yeah.
to handle those complex legal processes,
Right?
allowing you to stay focused on what you do best treating your patients.
That makes a lot of sense.
It does.
It's about leveraging the expertise of those who deal with these issues day in and day out.
That's right.
But aside from lien management firms, are there any other resources that providers should know about?
Absolutely.
Okay.
Don't underestimate the power of networking and professional organizations.
Okay.
Connect with other providers in your specialty,
Right.
attend industry conferences,
Okay.
join relevant associations.
I see.
These networks can provide valuable insights,
Right.
support, and even mentorship
Yeah.
as you navigate the challenges of workers' comp.
It's like having a built-in support system.
Of colleagues who understand what you're going through
Right.
and can offer advice and guidance based on their own experiences.
Exactly.
Yeah.
It's about tapping into the collective wisdom of the community.
Okay.
And let's not forget about the California Division of Workers' Compensation itself.
Right.
They have a wealth of resources available on their website,
Okay.
including FAQs,
Yeah.
guides,
Right.
and even contact information for assistance with specific issues.
So it's worth taking the time to explore their website
Yeah,
and familiarize yourself with the information and support they offer.
absolutely.
Okay.
And remember, knowledge is your most powerful weapon in this arena. The more you understand the system,
Okay.
the rules, and the resources available,
Right.
the better equipped you'll be to fight back against inappropriate denials
Yeah.
and ensure your patients get the care they deserve.
This is fantastic advice, Aisha.
Thank you.
You're really empowering providers to take control of this process
That's the goal.
and advocate effectively for their patients.
Yes.
But before we wrap up,
Okay.
I'd love to hear about a real-life success story.
Okay.
Can you share a case study that illustrates how these strategies can make a tangible difference?
Absolutely.
Great. Okay, Aisha, you mentioned a case study involving an orthopedic surgeon Facing a denial for physical therapy sessions.
Yes.
Let's unpack that a bit more.
Okay.
What were the specifics of that case?
Sure.
And how did the surgeon navigate the appeals process?
All right, so picture this.
Okay.
You're this orthopedic surgeon.
Okay.
You've prescribed a course of physical therapy for a patient recovering from a work-related shoulder injury.
Right.
You've carefully considered the MTUS guidelines,
Okay.
the patient's individual needs,
Right.
and their progress.
Got it.
You submit the claim confident that it's justified, but then, bam, you get hit with the denial.
Oh, no.
The insurer claims the number of sessions is excessive
Oh.
and not supported by the patient's progress.
I see.
What's your first move?
Well, if I were that surgeon, my heart would probably sink a little.
Yeah, I bet.
Denials are never fun,
Nope.
especially when you believe you're doing the right thing for your patient.
Right.
But I know giving up isn't an option.
No.
I'd need to fight back, but strategically.
Yes.
So I guess my first step would be to really dissect that denial letter.
Exactly.
Really understand what they're saying.
Yes. Don't just glance at it and file it away in the frustration folder.
Right.
You need to understand the insurer's rationale.
Okay.
What specific reasons are they giving for the denial? Are they misinterpreting the MTUS guidelines?
Right.
Are they questioning the clinical necessity of the treatment?
I see.
Pinpoint their exact argument.
Okay, so it's like putting on my detective hat
Yeah.
and examining the evidence.
Exactly.
Once I understand their logic, what's next?
Okay, so
Do I just fire off an angry email refuting your claims?
hold on there, cowboy.
Haha. Okay.
Remember, we want to present a clear, professional, and evidence-based appeal. Think of it as a persuasive essay, not a rant.
I like that.
You need to systematically address each of their points,
Right.
providing counter-arguments supported by concrete evidence from your patient's medical records.
So it's about being assertive, but not aggressive.
Right.
About using logic and evidence to build a compelling case.
Precisely.
Gotcha.
And this is where those meticulous medical records we keep emphasizing become invaluable.
Oh, right.
In this specific case, the surgeon had thoroughly documented the patient's initial assessment,
Okay.
the rationale for the prescribed physical therapy,
Yeah.
and the patient's progress over time.
I see.
Each progress note included detailed observations,
Right.
measurements of range of motion,
Okay.
pain levels,
Yep.
and functional improvements.
It sounds like they were creating a trail of breadcrumbs,
Yes.
clearly demonstrating the patient's journey and how the physical therapy was directly contributing to their recovery.
Exactly. They weren't just saying the patient needs physical therapy.
Right.
They were showing the insurer step by step why it was necessary
Okay.
and how it was working.
So they were effectively shifting the burden of proof back onto the insurer.
Absolutely.
Instead of just making a claim, they were backing it up with hard evidence.
Exactly.
Yeah.
And to further bolster their case, the surgeon attached a letter from the treating physical therapist.
Oh, okay.
This letter provided an expert opinion
I see.
outlining the patient's progress from the therapist's perspective
Right.
and emphasizing the importance of continuing the prescribed course of treatment.
So it's like bringing in a specialist witness
Yes.
to testify on behalf of your patient.
Exact.
It adds another layer of credibility and expertise to the appeal.
It does.
I like it.
And remember, the insurer's decision isn't final.
Right.
The IMR process is designed to provide an independent review of medical necessity decisions.
Okay.
Don't hesitate to utilize this process if you believe a denial is unjustified.
It's good to know that we have that option.
You do.
But realistically, how often are these appeals successful?
Well, it varies depending on a number of factors,
Sure.
but when appeals are well structured,
Right.
clearly written,
Right.
and supported by strong evidence, the success rates can be quite encouraging.
That's good to know.
Yeah, in this particular case, the surgeon's thorough documentation,
Right.
persuasive arguments,
Yeah.
and the supporting letter from the physical therapist ultimately swayed the insurer.
Wow.
They reversed the denial,
That's awesome.
and the patient was able to continue their physical therapy without interruption.
That's a win, not just for the patient,
It is.
but for the surgeon and the integrity of the system itself.
It is.
It shows that when we stand up for what's right,
Yes.
armed with knowledge and evidence, we can make a difference.
We can, absolutely. And that's the message I want to leave our listeners with today.
Okay.
Don't be intimidated by the appeals process.
Right.
Equip yourself with knowledge.
Okay.
Document meticulously. Present a compelling case.
Wow.
And don't be afraid to push back against inappropriate denials.
Yeah.
Your patients are counting on you.
Beautifully said, Aisha.
Thank you.
This has been an incredibly informative session.
Oh, good. I'm glad.
Thank you for sharing your expertise and insights with us today.
It's been my pleasure.
I know our listeners will be walking away feeling empowered and equipped to tackle those denials head on.
That's the goal.
And remember, you are not alone in this journey.
You're not.
We're a community of providers dedicated to ensuring that injured workers receive the care they deserve.
Absolutely.
Let's keep learning, keep advocating, and keep fighting the good fight together.
Yes. Couldn't have said it better myself.
That's a fantastic note to end on. Thank you for joining us for this episode of Workers' Comp Unwrapped.
Thanks for having me.
We'll be back next time with more tips and strategies for navigating the complexities of workers' comp. Until then, stay informed, stay empowered, and keep those denial letters coming.
Bye, everyone.
Thank you for listening to Workers' Comp Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.